Hello friends, welcome back to my YouTube channel. Today, I'm very happy to share with you my life story and how this one tool changed my clinical practice and my life for the better. I am sure you have heard and watched a lot of other videos saying that how their life have been changed by using Loupe. So today, I am going to share with you my story. To be honest, there are no words that can describe my joy of using the Loupe. So here, I will share with you 4 reasons why I love my Pentax Loupe. If you are looking for your first Loupe, meaning you don't have any experience using Loupe, or you are actually trying to contemplate whether you want to use Loupe and buy Loupe and to use it in your practice, or you have used Loupe before and now you are contemplating whether to upgrade to a better Loupe, getting higher magnification or whatsoever, or you are having pain, either your neck or your back, and now you are trying to figure out how to work more ergonomically. This is the video for you. So do watch until the end, and I know you are all very busy, so I included the timestamp below and you can skip through whichever portion that you want to focus on. Now, let's go. Reason number 1, I can work and see better in a pain-free manner. I can see and work better because Pentax Prismvue gives the best declination angle in the industry, period. And it has highly customizable working distance, which range from 35 to 70 cm. Mind-blowing, right? And my working distance is around 50-55, and I have customized my working distance to go on the slightly higher end, which is around 55 cm. Unlike conventional Loupe, Pentax Prismvue, it utilizes deflection technology, much like in a submarine, which gives the best declination angle, period, unparalleled to both TTL and flip Loupe. As you can see, my posture is very straight, my neck is very straight. I can work and look straight to the lens without ever looking down to the patient. As you can see, I'm working very comfortably. Reason number 2, I work more efficiently with it, and I use it all the time. I use it like for 99% of the procedure: checkup, cleaning and oral hygiene, minor oral surgery, restorative work, yes, orthodontic works, endodontic works, and even trimming my dentures. Yes, I am not kidding. And my current magnification is 5x. The secret is Pentax Prismvue have the best and widest field of view. Even with 5x, I can basically see first molar until first molar, which is very, very huge for a 5x magnification Loupe. How Pentax Loupe can achieve this? I myself am very amazed by their advanced technology. To be honest, if you are looking for your first set of Loupe, or you are upgrading from your previous Loupe, do consider taking a look and test and try it for yourself. Don't even bother looking or buying Loupe that is 4x and below. Why? Most of my friends who bought a 2.5 to 3.5x magnification, after a few years down the road, they all want an upgrade. Meaning to say, they are looking for 4x and above. This means that their old Loupe are actually collecting dust, and now they are using their 4x and above Loupe for 80% of their procedure. And if this is your first Loupe, don't even bother buying anything below 4x magnification. Of course, this is my personal opinion. If you're actually considering to buy a new Loupe, do check out my videos where I explain more in detail on how to choose a Loupe and the specification to look for. I will link it up here, and also I will put it down in the description. Well, you are welcome to have a look. Alright, let's dive in. Efficiency. Well, you must know, the number 1 most inefficient way to work is actually working two-handed dentistry. And even if you have four-handed dentistry, even if you have an assistant, most of us don't have the luxury of having highly trained dental assistant. Unlike Dr. Gary Carr, you can watch him in his YouTube. whereby his assistant is working amazing. They are very in tune in the procedure, and it's like watching a ballet. But not many of us have the luxury of having such highly trained assistant. So most of the time, we will change our instrument, our burrs by our own. And this leads to the most inefficient work. But you got to live with it. So in my experience, using previously conventional loupe, whenever I want to change burrs or instrument, I need to shift my head, shift my focus, pick it up, put it in or take it, and then shift my head again and focus back into the lens. This creates friction in my movement, in my treatment, in my procedure, and thus making me inefficient. But with Pentax Prismvue, I can sit much more upright, and with that straight posture, my peripheral vision is very huge, whereby I can simply look from the corner of my eye to pick up instrument, to change burrs without the need to change my head. So when I do that, I can simply change everything and refocus my eye back into the working area. This little improvement drastically improve my efficiency. Yes, of course, at times I need to change, I may need to look away, but my head movement is very minimal. It's very minimal. And thus, this allows me to become very efficient. With 5x magnification, it's good enough for most of my endo. Since I'm a general practitioner, I do not encounter cases of broken file, root end surgery or retrograde endo, or even having done extremely difficult case in very limited access molars. And I use it for all my restorative work. But at the same time, having a wide field of view allows me to use it for checkup, for orthodontic, and even, as like I said earlier, for my dentures. Reason number 3, it's fully adjustable. What does it mean by this? It means that unlike TTL or through the lens, you can actually have highly customizable loupe. And if one day you decide to sell the loupe, upgrade to a microscope perhaps, you can actually sell it. And thus, having fully customizable loupe allows a very high resale value, meaning the other person who wants to buy your loupe can actually tune the loupe to their needs. Unlike TTL, which is, I know everyone loves TTL, but one day, if you want to upgrade, you cannot sell the loupe to anybody. None of your friends, perhaps maybe 1 out of 100 of your colleagues actually have the same pupil distance, pupil height that can actually use the loupe. But much higher probability is that your loupes will be sorted in your loupe museum, where it will collect dust and not being used. And this is the common scenario, common place for most of my colleagues, my friends, who have been using TTL loupe. So this one value alone, this factor, having high customizability, allows high resale value. I have a great news for my friends out there who are wearing spectacles. If you are wearing spectacles, you don't need any special prescription lens. You can actually wear your spectacle and you can actually see the loupe via your spectacles. How cool is that? You don't need to have any LASIK, you don't need to buy any prescription lens. You can just wear your normal daily spectacle and just wear the loupe on top. And that is, for me, a killer feature that you cannot find anywhere in other loupe. Reason number 4, because it gives you the best bang for your buck, for my buck at least. Why? Because you have all this amazing specification. High working distance, very wide field of view, up to 5x magnification, fully adjustable, acceptable lens clarity. Of course, you cannot fight against Zeiss because for me, it has the best lens clarity. But I don't think it's really noticeable. Apart that's my opinion, that's my experience at least. But when you compare all these factors and the cost, it's actually very, very worth it. And for example, if you use it for like every day, like for me, I use it for 99% of my procedure. On average, I'll be using, for example, in treatment for 8 to 10 patients. So let's say for 10 patients, and I use it for every day. And if you multiply it by days, by months and years, and I'm planning to use it, for example, minimum 5 years, you are looking at a cost of 1 ringgit or less than $1 per usage. and that is very, very cheap for a dental loop. For me, the clarity is enough. If you are heavily using your loop for endo, perhaps you need to have a higher clarity of lens, Zeiss for example. And if you are doing endo every day, then perhaps microscope is the answer. You cannot win. There is no perfect loop, and no loop can actually win against a microscope. To be honest, there isn't a perfect loop. Each have their strength and weaknesses. But for me, after surveying and looking and testing so many loop, so many companies, so many suppliers, I feel Pentax is the near perfect loop that you can find. Okay, to be honest, I do have some issues using the loop. For example, because of the telescope is mounted right in front of you, initially when you are using it, you might have some blind spot, and you need to get used to it. Number two is you need to train yourself. You need to untrain and train yourself using indirect vision, meaning you cannot be working while looking down, and you need to train your muscle, your posture, everything to work in a straight manner. Number three, with a light attachment, you cannot really wear a face shield easily. As you can see, with a face shield, what happens is that the face shield will impinge on the light source, causing it to be distorted. So in order to wear a face shield, you need to find a face shield that is wide enough so that it can accommodate for the light source. So in order to overcome that issue, what I did was that I inverted the face shield and wear it face down like this, because when you are working in a straight posture, what happens is that most of the aerosol are coming down from the patient. So when you wear it like this, you are basically protected. That is all, my friends. So if you like my video, if you like my content, you can smash the like button and possibly considering subscribe. Stay safe, work smart.